Extreme heat has been linked to higher risks of preterm birth, low birth weight, even stillbirth, and to increased risks for mothers. It's the subject of a joint investigation by the Tributary and Climate Central. Here to talk about it, I'm joined via video by the Tributary's investigative reporting fellow for the summer of 2025, Mary Beech. Good morning, Mary.
Good morning.
We're also joined on the line by Melba Newsome. She is a health and environmental reporter and program director for the Environmental and Epistemic Justice Initiative at Wake Forest University. Melba, good morning. Thanks for being here.
Good morning. Thank you for having me.
Here in studio, we're also joined by Dr. Lina Fouad, founder and medical director of OBGYN Specialists of North Florida. Good morning, Dr. Fouad.
Good morning. Thank you for having me.
Thank you for being here. So, Mary, I'm going to start with you. You tell this story in this investigation that you did of a Jacksonville doula who's worked in that field for 32 years, and she had a troubling story to share about a client who was sort of personally experiencing some of these issues. Tell us what story she shared with you.
Yeah. So basically, when I asked her if any of her clients had struggled with extreme heat, she told me this really amazing story about a client of hers who was 7 months pregnant, and she'd had her air conditioning shut off because she couldn't keep up with the utility payments. And so basically, she went to work one day, and her workplace also struggled with spotty air conditioning. But basically, she was just at work one day and she had a job where she was on her feet and she just collapsed. She had to go to the hospital. She had heat stroke. She had $60,000 worth of medical intervention, and she was safe, her baby was safe, but basically she suffered really bad headaches for the rest of her pregnancy. She wound up having to be let go of her job because they didn't provide medical leave. And it was just, I think, a really difficult situation for her. And that story really stayed with Kelly, the doula that I spoke with, and it really struck me as well as just really illustrating how dangerous heat can be for pregnant people in Florida.
And this doula told you that in addition to fainting and having these medical interventions, she was also at risk of going into shock. Her amniotic fluid levels were dropping due to the dehydration that she had experienced. Is that right?
Yeah, absolutely.
Yeah. And so, Dr. Fouad, what are the risks? I mean, specifically, how are pregnant women uniquely vulnerable to heat, or are they?
Yeah, so it's a major health concern and maternal health issue. And ACOG put out a statement basically alerting providers to speak to their patients about this health concern. And women, pregnant women specifically, are very vulnerable because of the physiologic changes in pregnancy. So there's 5 main things that contribute, among others. There's an increased cardiovascular load in pregnancy. So there's 50% more blood volume being pumped around. So women work harder and they run hotter. So that increases strain. And if you add heat, there's more problems that could happen. We're also, pregnant women can't thermoregulate as efficiently. So that's why with heat, there's problems when it comes to pregnancy complications. Also dehydration and electrolyte deficiencies. So if you think of it, if you're dehydrated and you're sweating, that blood is kind of shunted away from the placenta and the vital organs. So if it either happens a few days out of, heat days, or over time, there can be preterm birth, there can be pregnancy complications, low birth weight, and at the worst, stillbirth. Other things that can happen in pregnancy are there's increased placenta with heat. There's increased placental stress and inflammation, and with dehydration, there's an increase in a hormone called oxytocin and prostaglandins, which we know induce labor. So that kind of results in the increased risk of preterm labor.
Sure. I mean, oxytocin is familiar to people who've given birth. That is actually something that's like an induction drug, right?
Exactly.
And so heat can actually produce the release of that hormone?
Correct.
Yeah.
Correct. And also dehydration makes the uterus, because of all the physiologic changes, the uterus can start contracting because it is a muscle. And that increases the risk of preterm birth.
Wow. Okay. And I mean, just for those of us who are listening and maybe don't know, I mean, a preterm birth, there are a lot of preemies that do just fine. They, maybe have to spend a little additional time in the NICU, but, very often there've been a lot of good results in terms of making sure that those kids, survive, first of all. But there can still be some long-term, lifelong term risks of being a preemie. So what are those?
Absolutely. So preterm birth, just by definition, is delivery before 37 weeks of gestation. And like you said, with all the advancements in medicines, babies do fine. But there are mostly cardiovascular risks long term. And there's just pulmonary complications, inflammation complications, and they're more vulnerable to getting infections as well. And it's a huge health burden.
Melba Newsome, I want to bring you into the conversation. First of all, can you tell us why the folks at Climate Central decided to drill down in particular on the risks to pregnant women? I know that very often we hear about, risks to the elderly, to children, to people who might be unhoused, but I don't know that we've been hearing as much specific to pregnant women. Was that kind of the impetus behind this investigation?
Well, the impetus was to initially we did a kind of dug deep and found how the extra days of heat were impacting certain population, and then they found that in the last 4 years, climate change has added 19 pregnancy risk days, and those are days when it's dangerous for pregnant women to be. This is in Florida. There are different days in different parts of the country, and so they did all of this data mining and mapping to see where the greatest impact was. And as you said, we talked a lot about the impact on seniors and different populations, but it wasn't until I think a study that came out in 2017 that showed that pregnant people should also be classified as vulnerable, added to that vulnerable population. And so that's why we drilled down on it, because a lot of people were not aware of the kind of the impact and then the multiplying effect, the impact of heat and the multiplying effect of climate change on that.
And so some of the information that is, part of this investigation is looking at worldwide temperature data and how that is increasing as the climate warms. So Melba, if you can, summarize what it is that we're seeing globally, but also, regionally, in places like Florida, when it comes to the number of what are defined as risk days. And perhaps you should define what that is. What is a heat risk day, for instance, for a pregnant person?
Well, a heat risk day is when it's like above a certain percentile of the average days. So when it reaches a certain temperature threshold, that is considered a heat risk day for pregnant people. And so they have outlined how many times it got above that kind of average threshold in certain states. But the temperature what we know is that temperatures are increasing globally. So some places faster than others, but definitely it is a global trend.
Yeah. And Mary Beech, let's talk a little bit about Florida. There is a little bit of a unique situation here, in part because of the climate, but also, as you report in your story, because of the political climate and in some cases the inaction of lawmakers to sort of respond to this growing challenge. Can you talk about, first of all, what the situation is in Florida in a heat standpoint, for people who are at risk, and then what some of the challenges are from a political standpoint?
Yeah, absolutely. So basically, in Florida, and this is not necessarily unique to Florida, it's a problem in a lot of states, but in Florida, it definitely is true that air conditioning is considered an amenity, not a right for a safe and healthy living space. So there aren't really any guarantees for air conditioning for renters, or even just like people who pay utility bills. So landlords are not required to provide air conditioning, even though they are required to provide heat for those very few days when temperatures dip below freezing. But yeah, their landlords aren't required to provide air conditioning. If there is air conditioning present when a lease is signed, they are required to maintain that air conditioning, but the law doesn't really go into specifics of what that maintenance requires. So basically, if they're like making an effort, they can kind of just provide less than ideal repairs to something that might not be functioning very well.
Mm.
And then that's on the landlord end. And then also on the utility end, there are no laws safeguarding people who pay utility bills, who might fall behind on their payments and then would have to have their electricity shut off. So even if it's the middle of a very dangerous heat wave where temperatures are, you know, at risk for human health, uh, your electricity can just get shut off because you can't afford to keep up with payments. So obviously, for people in at-risk groups, like the elderly, like as we've just talked about, pregnant people, that can be very dangerous. And that is, of course, what happened to that client that we were talking about earlier. She couldn't afford to keep up her payments, so her electricity got shut off, and that's why she was in such a dangerous situation.
And what do we know about the number of heat risk days in Florida, how that number is changing and growing? And also just how risky Florida is generally. I mean, the number of people who actually die each year in Florida because of heat exposure.
Yeah. So as far as the number of pregnancy heat risk days in Florida, Florida is notable as having the two cities in the country with the highest number of heat risk days added by climate change. It was West Palm Beach and Miami at 34 and 30, I think. Jacksonville has had, I believe, nine, and these are days in the 95th percentile, so where temperatures are hotter than 95% of days in, I believe, 1991 to 2020, so like, the recent past. Um, so that's heat risk days in Florida. And then, forgive me, I forgot the second half of your question.
Um, well, first of all, the number of we were talking about kind of the number of deaths that are caused by it.
Right. Yeah. I don't have specific death numbers for Florida, but I can tell you that in the United States, heat is the number one weather-related killer, and I believe it's responsible for over 2,000 deaths a year.
Yeah, and it does seem unusual that there, aren't those protections, Dr. Fouad, for residents in places that are extremely hot. We talk about you've got to have heat. And as Mary says, there aren't many days where we really have to have heat in Jacksonville, Florida, but there's a lot of days where you feel like
Right.
if you don't have air conditioning, you're really going to be feeling poorly, whether or not you're actually at risk. One thing that I'm curious about, and I know that both of these reporters touched on in their work, was the fact that the risk of heat exposure doesn't necessarily resolve itself just because you're out of the heat. So if you're living in a hot environment, if you're working in a hot environment, or you're just exposed, just getting cool that day doesn't mean that you have minimized or eliminated the risk to your pregnancy or to your unborn child.
Correct. Correct. Just throughout this whole process, it was very interesting for me to learn about all the political aspects, and just the statistics were very impressive. Um, so as far as I think one of the major problems is women of minorities, because of the areas they're called urban heat islands, where there's more paved roads, there's less tree, there's less shades, and as you said, it's not only hot during the day, but it's also hot during the night. And most of the studies, well, two of the big articles I think mentioned before, one was a JAMA article and one was an international journal of environmental research and public health, went over, I mean, they looked at like 30 million births, like stark statistics there. And they saw that women of minorities and the extreme heat and climate change are increasing stillbirth, preterm labor, and low birth weight
Yeah.
by a lot. And it wasn't always just the amount of heat days, and it's not always just additive. It could just be one exposure to extreme heat. So it's kind of it's hard to say how much exposure can lead to those complications.
Yeah. And Melba Newsome, I want to bring you back into this discussion because the question of, heat and how that interacts with, the economics of an area, the health demography of an area. You also talk about how, heat islands and the impacts of heat can be compounded by things like air pollution. Can you explain that a little bit?
Well, yes, but let me say this before we move on to that quickly. I wanted to talk about we talk about urban heat islands, which is great because that's focusing us on the danger of heat and how real that is. But it's also important to note that we have researchers who talk about the dangers of rural heat. Even though there's less concrete and pavement, they are at a greater risk because of certain things like lack of proper housing and more energy poverty, people who can't afford to cool their homes, and their homes are like poorly insulated. They're further from resources. There's the population is generally poorer and more elderly. So you have a vulnerable population, and because of the kinds of work a lot of them do, it's in certain communities that's just kind of working outdoors. A lot of and pregnant people who do outdoor work are even in a greater risk. So we don't want to overlook that part of the population and rural people. So I'm sorry, you did ask me another question that you wanted to talk
No,
about.
that's a good point. But I was asking about the kind of the confluence of air pollution and heat.
That was the thing that we talked about. Mary, what did you come up with that shows the connection between air pollution and heat, how it made the air more toxic and so kind of led to different like respiratory diseases and things like that with the air pollution in those areas combined with heat?
Yeah, there was an epidemiologist I spoke with, and also actually an OBGYN I spoke with, were both authors of a systematic review, and the review actually looked at not only heat but also particles in the air. They were looking primarily at particles in the air caused by wildfires. This was out in California, but it's not just particles from wildfires, it's also just air pollution in general, which increases with climate change. And they found very similar results with heat and air pollution, in that air pollution also contributes to all of these same things: preterm birth, low birth weight, stillbirth. And so the fact that both of those are rising at the same time because of climate change is sort of doubly dangerous for moms.
We should note that WJCT's Adapt is going to be doing a community discussion here about the tree canopy in Northeast Florida, and that directly, impacts both urban heat islands and the rural community of Northeast Florida. That's a free event at 5:30 on Wednesday, September 17th, and we're going to be talking more about that next week here on the program. But I did just want to point that out, and it is a very current issue that's getting a lot of attention. Mary, I just wanted to ask you about the regulatory issue of AC in Florida. Has there been any meaningful movement or appeals to lawmakers to try to either affect, requirements for air conditioning, or define what it means to properly maintain air conditioning, or to prevent utility companies from cutting off power to people who are in some of these vulnerable groups?
Yeah, there has been some push at the state level. A couple years back, there was a bill introduced. Unfortunately, it died in committee. So right now, we're not really in a terribly good place. Um, Yeah, it's unfortunate to say, but that's the situation.
All right. If you're just joining us, we are talking to investigative reporter Mary Beech, Melba Newsome as well, along with OBGYN Dr. Lina Fouad, about the risks of extreme heat on pregnancy. You can join our conversation at 904-549-2937, or you can email us at firstcoastconnect@wjct.org. So, Dr. Fouad, I'm curious, what you hear, what you advise patients at this point, knowing that some of these risks exist and are getting worse.
Right. So I think that's really important. Just recognizing being hot as not just like an uncomfortable thing, but that it's really a major risk, health risk. So looking out for the signs of heat, overheating, are in pregnant women, especially nausea, vomiting, increased heart rate, decreased fetal movement. Um, and those are all red flags for dehydration and increased heat in pregnancy. And those are all things that should prompt them to call 911 or seek emergency health care. And also to put out a safety heat plan as far as just routines, not going out between 10 a.m. and 4 p.m. when it's hottest outside. Um, Basically fanning, wearing light layered clothing, having a heat buddy that can check in on them during the heat days, since we're gaining every year about 19 more of those.
Yeah.
So that's really important.
Which is,
And just
I think,
hydrating.
yeah, I think it's worth kind of stopping on that point a little bit too. So, this investigation found that for this, we're seeing an additional roughly 20 days. And, that makes a difference, especially for people, bless them, who are pregnant during the summertime,
Yes.
Which can already be a hardship.
Yes.
And so those clients in particular, do you tell them to stay inside, or is it more just kind of being cognizant of the fact that extended exposure and the warning signs are something they need to look for?
Yeah, I mean, trying to avoid the outdoors, but sometimes it's just inevitable. Like was mentioned before, some people work outdoors, and they don't have access to AC, neither does their workplace. So staying indoors would be ideal between 10 a.m. and 4 p.m. and just having the means to just get a fan and maybe a cold pack. Um, and just looking out for the red flag symptoms and hydrating. Hydrating is pretty important. Drinking every hour. And if there's sweating involved, definitely trying to replace electrolytes as well.
Yeah.
So that's extremely important.
All right. I want to just take a call from JD in San Marco. Good morning, JD. Go ahead, please.
Good morning. Good morning. How are y'all? I just love you finally coming around to my topics. I'm actually a retired renewable energy executive. Back when Dickerson was head of in the 90s, was head of JEA, we put the solar on the airport. The fire, they had to tear it all down for the fire. We put the solar on all the little schools. You see little solar banks all over the schools. Well, 5 years ago, I sent a proposal to the city of Jacksonville to return all of these the little rest stop areas where you get on and off the tram, those little areas there where you sit and wait and everything. We could easily turn those into cool down centers using my solar powered atmospheric water generator. And that would be a perfect place for anybody downtown, homeless people or anybody that needs to cool down as a cool down center. I could do the entire project for less than $1 million. So I bet you Donna Deegan would just love to see that proposal. Maybe I should send it over there to her, because this was the other administration.
Not a bad idea, JD. I guess you could try to recycle that, certainly. And obviously the mayor has come up with some cooling center initiatives as well when a heat emergency is declared in Jacksonville. And there is information about that on the city's website. I know that they open up senior centers, but also buses, and sometimes have some other cooling centers. Libraries, that's right. And water distribution and stuff like that. So, Mary, I just would like to ask you, first of all, if you've gotten any response to the reporting that you've done, and, what additional reporting you would like to see done on this topic. What things are out there that you would like to explore or see somebody explore?
Yeah, I haven't gotten any feedback necessarily from the article. I welcome any feedback. You can reach me at mary.beech@jaxtrib.org. But as far as stuff in the future, I mean, I think just continuing to keep an eye on this. It's something that I feel like not a lot of people are talking about, so just continuing to talk about it. And obviously, unfortunately, this is going to keep escalating as the climate warms and warms. So I think just sort of keeping with the coverage
Yeah.
of what's happening. And then also all the other coverage of all the other ways that climate change affects pregnancy and pregnant people. Like in my article, I kind of talk a little bit about hurricanes, like what happens if you are somewhere and the bridges get closed and you can't make it to your hospital to deliver. Again, air pollution, even like if you're stranded in an extreme weather event like the PTSD, the mental health effects that can cause. There's just so much to talk about in this area.
Yeah, well, excellent reporting by you, Mary Beech, also by you, Melba Newsome from Climate Central, and here in studio, Dr. Lina Fouad. Thank you all so much for the work that you do and for being on today. Really appreciate it.
Thank you so much.
Thank you so much
Thank
for having
you.
us.